NSAIDs in bodybuilding, relief, recovery, and the hidden dangers. Introduction. When we talk about performance-enhancing drugs in bodybuilding, we usually think of steroids, growth hormone, peptides, or fat burners. But there's another category of drugs that is surprisingly common in the bodybuilding world: NSAIDs, or non-steroidal anti-inflammatory drugs. These include ibuprofen, naproxen, diclofenac, and even aspirin. While they're not anabolic, they play a big role in how athletes manage pain, recovery, and inflammation. Today, we'll break down what NSAIDs are and how they work biochemically, why bodybuilders use them, benefits and short-term advantages, risks and long-term dangers, best practices and alternatives. How NSAIDs work, the biochemistry. NSAIDs work by blocking enzymes called COX-1 and COX-2, cyclooxygenase enzymes. These enzymes are responsible for producing prostaglandins, which are molecules that cause inflammation, pain, and fever. By reducing prostaglandins, pain decreases, swelling goes down, fever is lowered. However, prostaglandins are also important for protecting the stomach lining, kidneys, and blood vessels. That's why long-term use of NSAIDs can lead to ulcers, kidney stress, and cardiovascular risk. Why bodybuilders use NSAIDs. Pain management during training. Heavy lifting often leads to joint pain, tendon irritation, and muscle soreness. Ibuprofen or diclofenac is sometimes taken to dull the pain and allow training to continue. Injury recovery. Acute injuries like strains, sprains, or tendinitis are often treated with NSAIDs to reduce inflammation and speed up return to training. Managing DOMS, or delayed onset muscle soreness. After intense workouts, many bodybuilders use ibuprofen to reduce soreness and stiffness, especially during contest prep when recovery time is limited. Competition prep and presentation. In some cases, aspirin or ibuprofen is used before stepping on stage to reduce inflammation and water retention, giving a tighter look. Stacked with PEDs. Steroids can increase joint stress due to rapid strength gains. NSAIDs are sometimes used in combination to handle joint pain and keep training volume high. Benefits for bodybuilders. Reduced pain, ability to keep training despite injuries, improved mobility during inflammation, faster short-term recovery from soreness. Aspirin has mild blood-thinning effects, which may improve vascularity on stage. Risks and dangers of NSAID use in bodybuilding. Muscle growth inhibition. Research shows that chronic NSAID use may blunt muscle hypertrophy because prostaglandins are actually involved in muscle repair and growth. Kidney stress. NSAIDs reduce blood flow to the kidneys, which can be dangerous when combined with creatine, dehydration, or high-protein diets. Stomach and GI problems. Ulcers, gastritis, and stomach bleeding are common in long-term users. Aspirin is particularly harsh on the stomach lining. Cardiovascular risks. Long-term diclofenac and ibuprofen use has been linked to increased heart attack and stroke risk. Dangerous if stacked with steroids that already stress the heart. Masking injuries. Painkillers let you push through pain, but this can worsen injuries instead of allowing them to heal. Best practices for bodybuilders. Short-term only. Use NSAIDs for acute injuries or extreme soreness, not daily. Lowest effective dose. Always stick to the minimum needed. Avoid dehydration. Drink plenty of water, especially when using creatine or diuretics. Take with food to reduce stomach irritation. Never rely on them as training fuel. They are not recovery tools, just temporary fixes. Herbal alternatives to NSAIDs. Omega-3 fatty acids, anti-inflammatory effect. Curcumin, turmeric extract, reduces inflammation. Proper sleep and recovery strategies. Cold/heat therapy. Physiotherapy and mobility work. Final warning. NSAIDs are not anabolic. They won't build muscle, but they can keep you training when pain or injuries strike. The danger is that they may trick your body into ignoring damage, and long-term use can harm your stomach, kidneys, and heart. In bodybuilding, the smart move is to use them sparingly, with medical supervision, and always address the root cause of pain, not just mask it.